Hello and welcome, and today we're going to be talking about lower back pain. So this has to be one of the most prevalent things that people will come in and see a chiropractor or a health professional. Now let's talk about the anatomy of the lower back. So we've got the spine here. On both sides you're going to have the pelvis, okay, or the nominate bones. It also has the tailbone or the sacrum, right? All three bones make up the pelvis, and then to the bottom you have the coccyx. Now normally what we would also see is 5 lumbar vertebrae or 5 lower back vertebrae. In the odd occasion some people might have 4, some people might have 6. Okay. Now on either side you'll find these yellow nerves. Both sides, these nerves come out and they supply muscles to your hips, so things like glute max, glute med. We also have the muscles down to our legs that are supplied by these nerves. In between these vertebrae we have what we call discs. Okay, these discs, they're there for 2 reasons. So the first reason is they allow for movement of that vertebrae. The second reason is they're acting like a shock absorber, so you can take, compressive forces, twisting forces, whatnot in your spine. Now, why do people get these injuries? Why do we get lower back pains? One of the reasons is prolonged sitting. So we're not meant to sit down for too long, whether that's in a car driving all day or that's at the office. So sitting is a big one. The other one is sporting. So sporting injuries, we might get a knock or we might twist awkwardly. And then the third one is, maybe we're doing, that weekend work where we're twisting, lifting, carrying heavy things, all these things that we're not meant to do. So in terms of treatment, it really depends on where the issue is. I mean, it could be the SIJ or the sacroiliac joint. So we might need to have a look at that. It could be the facets. It could be the disc. It could even be the nerves. Now, depending on where the issue is, also determines what type of treatment you have, and for also how long you're going to have treatment or you're going to need treatment and rehabilitation for. So, in terms of what we do, you've got options. So the options are spinal manipulations. That's commonly what we would use to help get these joints moving, but also decrease pain and improve function. Okay. The other thing is, if it is the muscles supporting, you can look at things like soft tissue techniques. That might include massage or PIR or PNF, certain techniques to really release that muscle and improve in flexibility. Okay. Now, depending on how severe it is, depends on the type of techniques that you would opt for. The other thing that you want to look at is rehabilitation exercise. So they're the exercises to strengthen the weak muscles and also stretch out those muscles that are too short or too tight. Commonly we see a distal cross pattern. That's where you have glute muscles that are weak, as well as abdominals, and then you'll get tight rectus spinae or back muscles, and also tight hip flexors, which are the ones that bring up your knee. Okay. If you'd like to know anything more about lower back pain, feel free to give us a call. You'll find the number in the button below.